So let us first start with certain important common organisms that cause urethral infections. Then we'll be talking about the common organism that cause vaginal infections. Then we'll be talking about some organisms that cause cervical infections. Then we'll be moving on to the overview of the sexual transmitted infections as a whole. Remember, first of all, STIs can be classified into discharge syndromes. We're going to predominantly have organisms like Chlamydia, Gonorrhea, Trichomoniasis, or Mycoplasma genitalium. And we have ulcer syndrome that will be discussed later on. We're going to discuss with syphilis, herpes simplex virus, chancroid, and donovanosis. Then we have the Wharton cancer syndrome. The most important that is going to be human papillomavirus. And we have other sexual transmitted infections which can be due to certain hepatitis virus or enteric pathogens that we'll be discussing later on as well. And the most important public relevance here is it's going to cause a very high health burden, especially when it comes to young adults. And most of them are often asymptomatic. The asymptomatic infection rates range from 50 to 80% approximately. So most of them are underdiagnosed, and this can lead to multiple transmission of infections in the community. And one has to screen and one has to notify the partner as well, and the partner has to be treated as well, which is going to be the most important key for controlling these infections. So coming to common urethral infections, what are the three organisms going to be Neisseria gonorrhea, Chlamydia trachomatis, or Mycoplasma genitalium? And the most important symptoms are going to be dysuria and discharge. And you're going to have a cloudy and purulent discharge. That is a turbid, purulent, pus-filled discharge if it's gonorrhea. But if it's a Chlamydia or Mycoplasma genitalium, it's going to produce more of a clear discharge, serous or serous discharge. And all of these infections are going to be primarily diagnosed via NAAT, that is nucleic acid amplification test. But even though culture media are available, but these organisms doesn't grow in standard culture. So it's better to go for NAAT. And for Neisseria gonorrhea, the most important treatment will be a single dose of ceftriaxone with azithromycin 1 gram. So that's going to be the most important. But I would say the most important treatment is going to be ceftriaxone in this regards. And for Chlamydia trachomatis, you're going to use azithromycin 1 gram stat or probably doxycycline 100 milligram BD for 7 days, even though I would prefer doxycycline in non-pregnant women. And in pregnant women, I'm going to use azithromycin. And for Mycoplasma genitalium, azithromycin can be used, which is the most common drug that we use in practice, but it comes at 50% resistance rate. So in those cases, you might need to treat with moxifloxacin 400 milligram daily for 2 weeks. Coming to common vaginal infections, we have something called bacterial vaginosis, Trichomoniasis, and Candidiasis, and most of them are going to present with discharge, but bacterial vaginosis is going to come without pain or pruritus. It's just discharge, and it's going to be malodorous in nature, often termed as a fishy odor, and it's going to have a homogeneous appearance. And we're going to use something called AMSL criteria for diagnosis. We'll be discussing that later on, and that you have to satisfy at least 3 of the criteria. And treatment is going to be with metronidazole, standard drug, 500 milligram 2 times a day for 7 days. Trichomonas is going to present dyspareunia predominantly, that is pain with intercourse, and patients can present with dysuria and soreness in the vaginal area also. And they're going to have a typical greenish yellow discharge, and it's going to be frothy in nature. And the most important investigation is going to be NAAT, and samples for that can be from vaginal or endocervical secretions, and sometimes it can be urine as well. And treatment is going to be metronidazole 2 grams, single dose, that's it. And Candidiasis is going to present with a white, thick, or a curdy white discharge. I can say it's going to be odorless. And vaginal dryness is very, very important symptom. Along with it, they will have dyspareunia, that is pain with intercourse. And one has to do wet preparation in that you can prove the yeast and pseudohypha, and you have some standard culture media that can grow Candida as well. Treatment of choice is clotrimazole, which is available over the counter, or you can just treat with fluconazole 150 milligram single dose. Coming to common cervical infections, going to be the same: Neisseria gonorrhea, Chlamydia trachomatis, and Mycoplasma genitalium again. And the diagnostic standard is going to be the NAAT, nothing more than that. And symptoms are going to be in the form of vaginal discharge, dyspareunia, and pelvic pain for all 3 of them. Treatment is going to be the same. If it's Neisseria gonorrhea, going to treat with zone plus azithromycin single dose. And you're going to treat Chlamydia with either azithromycin or doxycycline, depending on the pregnancy status. And Mycoplasma, the most commonly used drug is azithromycin, but in resistant cases, it's better to use moxifloxacin, 400 milligram OD for 14 days. And coming to Chlamydia trachomatis infection. So it's a gram-negative obligate intracellular organism. So that's the reason it doesn't grow in any standard culture. It's an atypical organism. And the genital serovas, the serovas D to K, are the ones that are going to produce the urogenital and the anorectal infection. In that, specifically the L1 to L3 is what we refer to as the LGV serovars, right? So that is lymphogranuloma venereum serovas, which tend to produce invasive proctitis, especially in patients who are homosexuals, that is men who have sex with men. And it cannot be cultured conventionally because it's an intracellular pathogen. and it's the most common sexually transmitted infection globally, and the prevalence is going to be maximum in the women's aged 15 to 24 years. And reinfection is quite common as well.